The UK has started rolling out the Pfizer vaccination. It's the first country to do so. So that's been the big news all this week. The inoculations began on Tuesday, and the country has even appointed a special minister to actually oversee the whole process, given it's such a logistical challenge. It's a challenge that many countries are currently gearing up for. Canada too has given its go-ahead for the Pfizer vaccine. The US too is expected to give that go-ahead perhaps by tonight, and the vaccine doses can start moving out by tomorrow. So many countries gearing up for that challenge with the vaccines. Here to talk about what it's been like in the UK, we're now joined by UK's vaccine minister, Mr. Nadhim Zahawi. He's been especially appointed for this very purpose. So thank you so much for speaking to NDTV. You've been especially appointed to oversee this marathon of vaccinating Britain through. Take us through how the UK is doing this, the logistics, given that there is no precedent.
It is early days, and it's worth reminding all your listeners and viewers that we're going to take this very carefully, deliberately carefully, step by step. There's been a lot of planning taking place within the NHS, obviously, and collaboration between the NHS in England, in Scotland, in Wales, and in Northern Ireland. So we're working currently through hospital hubs. We operationalized across the 4 nations about 70 hospital hubs yesterday to be able to vaccinate as the Joint Committee on Vaccination and Immunization has given us the 9 categories, with the first 2 categories, which is the over 80s, who are the most vulnerable to the coronavirus, because age clearly is the lead vulnerability in many ways to death from coronavirus. And of course, frontline health and care staff as well. And then we will begin to go down the category lists. We will operationalize primary care networks. These are the networks of GPs in particular areas, about 30 to 50,000 population in an area, roughly, who will then offer the vaccine. And then as we begin to get greater volumes of this first vaccine, but also the other vaccines, AstraZeneca, Oxford vaccine is in front of the regulator at the moment. Obviously, the regulator is independent of government, but if that gets regulated and other vaccines, then we have greater volumes. So we will have vaccine centers that will also be mobilized. It's a huge operational challenge to deploy, but also a large supply challenge with supply chains of these vaccines as well. But the team I have is really first rate, and I am enormously grateful and confident in their ability.
Right, sir, a bit of a difficult one, but how soon before all of the UK, all age groups are vaccinated?
Put a timeline and you'll understand this when I explain to why. First of all, at the moment, I can only assume to work with one vaccine, which is the Pfizer BioNTech vaccine, until I know what other vaccines are approved by the regulator. Then I'll be able to assess how quickly we can ramp up the vaccination process. In the meantime, as I said, we're working carefully because we want to make sure the deployment also is done in a proper way. This first vaccine requires it to be stored at minus 70 degrees centigrade. And so its movement is very, very, presents many challenges, operational challenges. Other vaccines will have different operational challenges as well. So until I know exactly, which vaccines I have in the pipeline and therefore the quantities that we will be receiving, and of course, making sure we get the deployment right and the scale up, I wouldn't want to give you a sort of day, because I think this is also making sure that we manage this process really carefully. It's better to get it right and do it well and do it safely than to sort of, try and sprint. I'm going to use your analogy. This is a marathon, not a sprint.
All right. And you mentioned about the Oxford vaccine. That's one that we're waiting for over here as well. So where is it currently on the Oxford vaccine? When is that expected to be ready?
Oxford AstraZeneca is looking good, but and this is a caveat that I have to share with you, is until our independent regulator, the MHRA, the Medicine and Health Care Products regulator in the United Kingdom, actually regulates it and gives us the instruction as to how we then are able to administer it, I can't be certain as to when we will be able to begin to vaccinate with the Oxford-AstraZeneca vaccine. But what we have done is, just like with Pfizer BioNTech, where we've ordered 40 million doses of that vaccine, we've ordered 100 million of the AstraZeneca Oxford vaccine. In total, by the way, we've ordered 357 million doses across 7 different vaccines.
When the authorization was given, the safety data was, yet to be fully shared on the Pfizer vaccine, and therefore questions arose: was this decision rushed for economic reasons, or do you have the complete backing from the medical fraternity?
So, in terms of the Pfizer BioNTech vaccine, the regulator didn't cut any corners, didn't actually take any shortcuts. They did exactly what they would do with any vaccine candidate that they would receive. The difference, the reason they were able to do it far more quickly, is they paralleled the different phases. So phase 1 is about the safety of the vaccine, phase 2 is around how effective the vaccine is, and then phase 3 is the big trial that looks at safety and obviously efficacy as well. They paralleled those instead of going sequentially through them, which takes much longer, obviously. So the MHRA is one of the best regulators in the world, and we're very proud of that. And they were very, very careful in the way they looked at this vaccine, and therefore we have every confidence in their ability to regulate. And I hope they'll be able to do the same with AstraZeneca, Oxford, and other vaccines that will come along.
All right. And Minister, any challenges that you'd like to throw light on so other countries could be better prepared? Like in India, for example, we're also preparing for this, but other countries can get better prepared for a smoother rollout of the vaccines.
The challenge is two-tiered. One is the supply chain challenge, and you've got to, the first vaccine requires cold chain supply, as we talked about the movement and storage at minus 70 degrees centigrade. And then there's a deployment challenge. How do you get it initially into hospital hubs, which we did yesterday, into 70 hospital hubs? How do you then increase that number and then take it into the primary care networks, the GPs, obviously, and then into the vaccine centers? All of those things have challenges around them in terms of deployment, training, workforce, technology. So there's many challenges to this process. But I'm confident that we have the team and the ability, and a lot of planning has gone into this to be able to deliver.
Well, Mr. Zahawi, thank you so much for speaking to us here at NDTV. So big challenge there, rolling out the vaccine program once it's in place.